is ibuprofen. Ibuprofen is a non-steroidal anti-inflammatory drug which is commonly known as NSAID. The main job is to reduce inflammation and relieve pain by blocking the hormones that cause these issues. You also can recognize it by its brand names such as Advil and IRFAN. It is widely used as anti-inflammatory and analgesic, meaning a pain reliever, and also as an antipyretic to reduce fever. Essentially, ibuprofen is a go-to solution for various common diseases. So now, let's take a look at how ibuprofen is made. It's synthesized through a series of chemical processes, starting with isobutylbenzene and acetic anhydride. The process involves steps like a Friedel-Crafts acylation, carbonyl reduction, chloride substitution, and Grignard reaction. To ensure the final product's quality, the structure and purity are confirmed using techniques like IR spectroscopy and melting point analysis. The molecule of ibuprofen, as you can see here, reflect its complex but well-designed structure. Next, I will talk about the specific usage of ibuprofen. First of all, ibuprofen is commonly used for migraines. It is effective for treating mild to moderate migraines and tension headache, so that it can offer a quick relief to the person. Secondly, it is used for post-surgical pain. Ibuprofen is a common prescription for managing pain after having a minor surgeries or dental procedures. And lastly, ibuprofen is used for sport injuries. It helps to reduce inflammation such as strains, sprains, and other injuries, making it a reliable option for athletes. As you can see here, ibuprofen is a really versatile medication used for a variety of situations. That's all from me. Let's move to the next person.
Danger and side effect of taking ibuprofen. For example of common side effect of ibuprofen is stomach pain. Ibuprofen can irritate the stomach lining, leading to discomfort, cramping, or general abdominal pain. The second one is diarrhea. Some people may experience gastrointestinal distress, including diarrhea, after taking ibuprofen. This may occur because the drug can alter the balance of fluid in electrolytes in the guts, causing more frequent bowel movement. The third one is heartburn. Heartburn of acid reflux is another common side effect of ibuprofen. This happens because ibuprofen can relax the lower esophageal sphincter. The muscle can keep stomach acid from flowing into the esophagus.
Next, the example of side effect of taking ibuprofen is blood disorder and blood clotting. In addition to gastrointestinal issues, ibuprofen can also impact the blood on faulty mechanism, leading to more serious risks for certain individuals, particularly those with bleeding disorder or those taking medication that affect blood clotting.
Now, let's talk about cardiovascular effects. Long-term use of high doses of ibuprofen has been associated with a slightly increased risk of serious cardiovascular events, such as heart attacks and strokes. While this risk is generally low, it's important to consider if you have a history of heart problems or if you're using ibuprofen frequently for chronic pain. Always consult your healthcare provider to ensure it's safe for you. Other than that, we have allergic reactions. Some individuals may be allergic to ibuprofen. Symptoms of an allergic reaction can range from mild to severe and may include rash, itching, swelling, severe dizziness, or trouble breathing. If you notice any of these signs, especially trouble breathing or swelling, seek medical attention immediately.
For gastrointestinal issues, ibuprofen can irritate stomach lining, leading to symptoms such as indigestion, heartburn, nausea, and in rare cases, stomach ulcers and bleeding. The risk may increase if the individual had history of stomach ulcers and bleeding, uses anticoagulant, or smoking. Other than that, Ibuprofen also can affect kidney function, and prolonged use of high doses may lead to kidney problems. Some of the symptoms are increased blood pressure and urinating less frequently. The risk is higher for individuals that already have kidney diseases and old adults. Here what you can do to minimize risk. If you need to take ibuprofen, here are some tips to reduce the likelihood of side effects and protect your health. Firstly, take with food or meal. To minimize stomach irritation, always take ibuprofen with meal or food. This can help buffer the effects of the medication on the stomach lining. Secondly, use the lowest effective dose. Avoid taking high doses of ibuprofen unless absolutely necessary. And always follow the recommended dosage instruction provided by your doctor or on the label. The lowest effective dose for the shortest period of time can reduce the risk of side effects.
Furthermore, you need to monitor for signs of bleeding. If you experience unusual bruising, blood in your stools, or vomit that looks like coffee grounds as a sign of gastrointestinal bleeding, seek medical attention immediately. This could be signs of a serious side effect that needs urgent care. Lastly, you need to consult your doctor before using ibuprofen. If you have a bleeding disorder or on a blood thinning medication, it's important to speak with your healthcare provider before taking ibuprofen. They may recommend alternative pain relievers or adjustments for your treatment plan to reduce your risk of bleeding complications.
So, welcome to this comparison of two common medications, ibuprofen and paracetamol. We will now explore their uses, how they work, their effect duration, and recommended dosage to help you make a better choice in which one to choose. So for the first point, we have effect duration and dosage. So let's talk about how quickly these medications work and their dosage. For ibuprofen, it starts working in between 15 to 30 minutes and provides relief for 6 to 8 hours. The recommended adult dosage is about 200 to 400 milligram up to a maximum of 12,000 milligram per day. When it comes to their mechanism, ibuprofen provides pain relief, reduces fever, and has strong anti-inflammatory properties, making it suitable for conditions involving inflammation. While paracetamol here also reduces pain and fever but has minimal anti-inflammatory effects. It is crucial to stay within these limits to avoid side effects, don't you think so? So, which one would you choose? For pain with inflammation, such as spinal toothache, ibuprofen is more effective, while for fever or general pain without inflammation, paracetamol is a better choice for you. In some cases, both medications can be used together for enhanced pain relief. However, this should only be done by medical guidance, which means you need doctor preference first before use. So that's all from me. Let's move to the next slide.
In conclusion, ibuprofen is a widely used and effective medication for managing pain, inflammation, and fever. Its versatility makes it a go-to treatment for a range of conditions, from minor headaches to chronic arthritis. However, like all medication, it should be used responsibly to avoid potential side effects, such as gastrointestinal issue, kidney damage, or cardiovascular risk. Consulting a healthcare provider is essential, especially for a long-term use or if you have a pre-existing health condition. When used appropriately,
Ibuprofen is a safe, reliable option for pain relief and inflammation management.